Okay, so I decided to do my mini research project on spinal cord injuries. So a spinal cord injury can be mild or it can be extremely severe. It's caused by a traumatic injury, and it's when the spinal cord is either bruised or teared. It can be torn partially or it can be completely torn into separate pieces. Some of the most common ways that spinal cord injuries happen is when somebody falls from an up high place, or motor vehicle accidents, whether that's someone being hit by a car accident, a motorcycle accident. Diving accidents are also another common cause of them. Violence such as gunshot wounds or abuse or even just different types of infections can be the cause of these. So the reason that I chose this is back in high school I was in a car accident and I fractured my T12 and L1 vertebrae, and I had to have reconstructive surgery to put those back together and to fuse my spine. And in the beginning there was a lot of just concern about whether or not my spinal cord had been impacted. It hadn't, fortunately. So due to that accident, I spent a lot of time in physical therapy and I learned a lot about the vertebrae in my spine, but not necessarily much about my spinal cord or injuries that can happen to it because I didn't have any. And then also last year there was a potential problem where we thought that we were looking at a potential bruising of my spinal cord, or a potential problem with the nerves running through my arms and into my fingertips. And so I kind of learned a little bit more about it, but was still very unfamiliar with these types of injuries and how to diagnose and treat them. I think that this topic is helpful with being an exercise science major and hopefully going on to grad school for physical therapy. I really want to work in a trauma care unit since that's what made me decide to even go into this as a profession. And in trauma care units, you're going to see spinal cord injuries. You're going to see things that are very hard to deal with. And I think that this is useful information for me to know if I want to work in that kind of setting. I also want to be able to be a physical therapist that can explain exactly what's going on to my patient and help them understand what they've been through and the ways that they're impacted, instead of just giving them a quick gloss over of their injury. I want them to actually be able to understand how their body works and why these things are happening. So the symptoms of spinal cord injuries is a wide range. Obviously, these are going to differentiate from person to person based on the severity of their injury, whether it was a bruising or a tear. Not everyone is going to have all of these, but these are some of the most common symptoms. So neck pain, radicular pain, any limb weakness, tingling sensations and numbness, and these can go out into your limbs, so in your fingertips, in your feet, in your arms, and your legs. Tightness of your limbs. One of the biggest signs for it being a spinal cord injury instead of just being a spine injury is if you lose your bowel or bladder control. That's a huge sign that there's a bigger problem there and that something needs to be done immediately. Some people also have an inability to feel temperature and touch. It can cause breathing problems if it's high enough up in the cervical vertebrae. And then in more extreme circumstances, people can become paraplegic or quadriplegic, just depending again on where their spinal cord is damaged and the extent of that damage. So when it comes to treatment for a spinal cord injury, again, it's just going to vary depending on the severity of the treatment and that person and their activity levels before their injury. So spinal cords they can't be repaired. You can't fix that damage when damage has happened specifically. But there's such a huge importance of their on-site rescue and the emergency care Like if somebody has been in a car accident, it's really important how the paramedics handle that situation, how much they move the person, whether or not they cause more damage, and then also early specialists that the patient will see early on. So these are really going to play an important role in the types of activities that they are able to do following their injury. Once all of the primary stuff has happened, the main focus during the spinal cord injury is going to be prevention of further damage to the rest of the spinal cord that is still intact. And then they also want to protect the normal spinal cord tissue, so they don't want the problem to become worse or to spread. And then following that, a lot of your treatment is going to be drug therapy and finding a medication that can help. One of the big things is helping reduce the inflammation of the spinal cord, to help them not be in as much pain, and to also give them as much mobility as they are capable of handling. So I guess I was really surprised at how touch and go spinal cord injuries are. There's just so many factors, and unfortunately I was only able to find, for this research project I found these 2 case studies, but case studies are really hard to find for this because you can't just go and ask people to maintain a spinal cord injury for research. That's not ethical. So it's a very limited research pool, and there's not a lot of test subjects because you have to go to people who have already had spinal cord injuries, and usually they've already been through a lot of preventative care and drug therapy by the time that people get to them, because the primary concern when somebody has a spinal cord injury is making sure that they don't cause further damage and that they protect the intact spinal cord. So there's not a lot of data on these types of injuries. But these are the references that I used, and thank you so much.